All right, hello everybody. My name is Dr. Gus Choplis, and this is Zoe, and this is my spine, Khalil. Just kidding, Khalil is actually doing our camera work. Thank you very much, Khalil. We're going to talk a little bit about taking care of our spines today, especially while we're at home and sitting in front of our computer. We've had a lot of patients asking us the kinds of things that they can do to better help take care of their spine while they're at home. We call it spinal hygiene. And if you can continue to do that for yourself through the day, you will develop a better ability to deal with or to experience optimal spinal health and keep your spine nice and healthy. So let's just focus on the top part of the spine. We divide the spine into three areas: the top, the cervical, the middle, the thoracic, and the lower, the lumbar. Let's focus on here, and Zoe's going to help show us some exercises. So for the top part of your spine, again, we lose a lot of our healthy position being on the computer all day, hunched over that computer. I'm going to get Zoe to just straddle the table, and what we're going to do is show an exercise where the head goes forward and backwards, so it glides forward and backwards. So Zoe, if you can go ahead and just demonstrate that, or start demonstrating that. So notice her chin is going way out front of the rest of the shoulders. Shoulders are staying balanced. And then she's going to double chin that head back over the rest of the body. Excellent. And then do that again. So we like to do this about 8 to 10 times. This is basically like flossing your teeth. We're flossing the joints of the spine, getting good healthy movement through those joints, allowing the nerves in the body to open right up. So just nice and full all the way out and all the way back, double chinning, good. And you might want to even hold the front of your chest or sternum to give yourself some stability. Good, keeping the shoulders there and then coming right on back. We'll do another 3 or 4 of those. Good, notice the ears are staying level. The head is gliding right out front like a chicken or a turtle poking its head out front and then coming right on back. Excellent, so we're not saying yes or no, we're just gliding all the way out and back. Good, and one more good one here, Zoe, right after. Excellent. Good, and you should be able to breathe or talk or sing if you want to while you're doing that exercise. That's awesome. Okay, thanks so much, Zoe. Good stuff. So the second one is a full extension. So we spend, again, a lot of our time going forward or reading a book or using our device in front. So we want to stretch that out. So Zoe, we're going to put our hands on our forehead. Good, and just let the head come back, all the way back. I like the idea of really letting the elbows spread out and open up. We do a lot of volleyball around our clinic here, and we talk about the position of the arms. We want those arms to be nice and open, wide open, and just holding on that forehead, allowing that forehead to just really sink back in. She should be able to be staring right at the ceiling. She's gently squeezing through those shoulder blades there as well. And with that attention, she's feeling that compression in the back. So we're going to hold that for about 30 seconds. Nice deep breaths, breathing into the lungs, allowing those lungs to expand and contract while we're doing this. It's basically a forced yawn. You can go ahead and back down to neutral. Good stuff. But you can really feel that back here, hey?
Yeah.
It's almost too much. You don't want to do too much, but about 30 seconds is really, really great time frame, I recommend. And then the third exercise, maybe we can just straddle or face the camera here for this last one, is basically to take the spine and really give a good stretch right and left. So we're going to give a good stretch. So we're going to use your right hand on top of your head and give your head a nice, gentle ear to shoulder pull down and just opening up through that left part of the spine. Good. If you're standing, you can have that left arm go right down to touch the knee, just allowing that nice healthy stretch. We don't want to bring the chin down too much. You want to keep the chin up nice and high. And again, gentle squeeze behind the back. Shoulder blades, perfect. And good. And then we're going to do the other side too. So again, we're doing this for about 6 to 10 seconds on both sides, feeling a nice healthy opening and stretch to that side of the body. Very good. Okay, so that's the top part of the spine. Thanks for watching.